I think that some of the shock of the coronavirus pandemic has begun to wear off. And many people are finding that our job, in a way, is to use this time of global pause, as my friend sister Jenna has called it, in a constructive way. In a constructive way, not only in terms of our own lives, much to think about, depth of communication, looking at feelings and relationships, all kinds of things at a kind of deeper level, a level that we have in many ways, in many cases, avoided. I know I've seen that in my own life, for sure. Also, we are called upon to think about those who are having a time that is much more difficult than ours. Not only those who are sick, but those who economically are put in a position of little more than survival mode. Sometimes survival mode itself. We already had 40 million people living in poverty in the United States. We already had 40 million or so living who are hungry, because that goes with poverty. We already had 40% of Americans who could not afford an unexpected $400 expenditure. And yet all that the congressional bailout has given is a one-time $1,200 payment. How is that going to pay all the bills? And Congress has gone on recess. I can't believe it. They've gone on recess. You know how people who have essential services continue working, doctors, nurses, garbage men, grocery suppliers. They're working because their services are essential. So is Congress not an essential service? And if they're not, what does that say? But we need to think about the things that need to be thought about. I'm not saying they're not thinking, but I think it would make the American people feel really confident if we thought that those guys were working around the clock. And one of the things that they need to be working on is the next coronavirus bailout piece of legislation, because that $1,200 one time is not going to do the trick. Every American should be getting $2,000 a month as long as this lasts. Hunger, a tsunami of hunger, that's my fear. I fear a tsunami of hunger on its way. I'm very blessed because a friend of mine who I just happened to be visiting said to me, well, just stay here, Marianne. But when I think of the millions and millions of Americans who are not quarantined in a place where they are loved and well taken care of as I am, what about old people who are unable to take care of themselves or even get things for them, for whom the people who normally take care of them aren't coming around right now because they're afraid to come around or whatever? What are those people doing? There are people right now who are looking at a loaf of bread in their kitchen and hoping it will last. We've not had starvation in this country, but we've had a real hunger problem for a while, although it's one of those kind of things they keep on the periphery, because the political establishment doesn't really much talk about the genuinely poor in this country. Why? Because the genuinely poor in this country don't tend to vote. Just like all the chronically traumatized children in America. This huge problem that's going to be just like everything else, which is one day it'll all explode in our face and we'll go, oh no, how did that happen? Why isn't it being addressed currently? Because those kids don't vote. So one of the things that we need to do right now is not only be thinking about these people who desperately need help. If you want to talk about the use of the National Guard, I'm fine with the National Guard being brought out to help build these temporary hospital facilities. That's a good thing. Those National Guard, however, should also be organized in such a way that they could deliver free food should that become necessary down the line. Because if we're only giving people a $1,200 one-time payment, hunger will be a real problem. The food banks are completely overwhelmed. This is what I mean. And Congress is like on recess. It's astonishing. But you know what? We don't have anything to do but sit down and think about all this. I read that the oil companies are using this time to just ram through that Dakota pipeline. And that's why I tweeted the other day, think about what you want to have happen on the other side of this, because some of the people who do not wish you well, man, they're thinking about what they want to have happen because of this. In my presidential campaign, I did not stand for Medicare for all. My whole health plan, which, I left all my issues up there on Marianne 2020 because they're still as valid as they were when I was running on them. But I don't see how we can do this in the future without Medicare for all, because the specter of the coronavirus is going to be with us for the rest of our lives. Even when the pandemic is over, we're not going to know. We're not going to know. Right now we have a flu season. Every year there's a flu season. We're not going to know. Is there going to be a coronavirus flu season, God forbid? We're not going to know. So one of the things that we're learning from this is, man, we have to have an entirely different kind of healthcare system. And when you see the countries that have done well with this, among other things, they had healthcare systems that could be given this kind of top-down approach of just get it done, get it done, get it done. And that, of course, is what should have happened with the President and the Defense Production Act, where companies, and weeks before anything like this began to happen, companies should have been directed to make respirators, directed to make masks, directed to make ventilators, and now directed to make medicine. Because what's happening, and this is really horrible, is that when ventilators are put in people, it's uncomfortable, to say the least. And when a doctor says it's going to be very uncomfortable, that means it's going to hurt like hell. So they use propofol and really powerful drugs to make a person able to handle the experience of having that ventilator put in. They're afraid of running out of that medicine. And then when people don't have the medicine, they just instinctively try to pull it out. This is a horror show happening. So that's another thing that the Defense Production Act should be used for, is to direct companies to make that medicine. And this stuff should have been done right at the beginning, because a lot of these things take time to produce. So we want to think about what kind of a country and what kind of a world we want on the other side of this. One of the things that this situation has made very clear is that we are one human family. We are all equally vulnerable, equally fragile, and there needs to be interdependence and cooperation among nations at a whole new level. We were skating on very thin ice even before this happened. It's not just on the level of pandemics, it's on the level of nuclear disasters, it's on the level of biochemical disasters, on the level of weather disasters, where we're just kind of, close to the edge, but like, it's okay. If anything gets too terrible, we'll figure out what to do then. We have to rethink all of this. Not just hope somebody else is doing it for us. We need to be thinking about the world we want on the other side of this, because if we go back to the world being as it was on the other side of this was something equally awful. It is reasonable to assume will be on its way to us, or at least to our children. This is calling us to mature on a level that is uncommon for this generation of Americans. We're being called to mature intellectually, socially, politically, economically, and spiritually. And all that spirituality is the path of the heart. I think most people get that they should live from their heart. The issue is how our public policies are guided. Are they guided by heart? No. if they were, we would see public investment in the kinds of things that would have made us much less vulnerable to this occurrence. It's time for some very, very new systems, some very, very new consciousness, some very, very new awakeness. And we are all going to have to participate. We're going to have to elect some very different kinds of people with a very different kind of consciousness. I believe in American democracy. I believe in it a lot. One of the things that running gave me was a deep, deep respect for the intelligence of the American people and the intelligence of the American voter. But we need to get involved. And if and when we do, we are going to be a better America on the other side of this. We are going to be a better world on the other side of this. I'm sure I'm not the only person who's been reading about pandemics in history and how they were often followed by periods of great blossoming. After the bubonic plague, there was the Renaissance and so forth. So, we can have that. But we need to decide to have it. We need to decide. We need to will it. We need to think about it now. And then on that blessed day when this is over, please God, may it be sooner rather than later, we need to hit the ground running. Thanks. Nice talking to you.